Finally, someone said it.
Ask ourselves, should we be focusing more on school lunch programs, not just putting every kid on Ozempic? We've got to talk about food as medicine and gut health and the microbiome. We've got to talk about environmental toxins that cause cancer, not just the chemo to treat it. And maybe we need to treat more diabetes with cooking classes, not just throwing insulin at people. This report is a fresh new approach that really calls for a transformation of our healthcare system from a reactionary system to a proactive system. So I could not be more excited about this report. There are no sacred cows. It talks about 70% of the diet being ultra-processed. It talks about pesticides, microplastics, natural light exposure in children, sleep quality. Remember, Republican, Democrat, and independent moms showed up in high numbers to vote for President Trump over this very issue.
Yeah, and Dr. McCary, as you know, I'm a cancer survivor. So after that experience, I dug into the gut and the microbiome and the chemicals and the issues that can impact that potentially for people. So I am with you, but at the same time, covering business for so long, I also know that food is a big industry. There are many lobbyists out there in Washington that are fighting to keep everything just the way it is. How do you combat that?
You know, this is a purely independent scientific report on the state of health in America. And when we talk about payment reform, we're really talking about how we fund our broken healthcare system. This report talks about how we fix our broken healthcare system by getting at the root causes and the ultimate issue that we've not been talking about, and that is the health of the population. When you have 40% of our nation's children with a chronic disease, that portends for a very expensive future healthcare system. We can address it.
Let's be proactive. Let's be healthy. Follow us for more.